Hello, I'm Dr. Pat Mallory. Welcome to the practice. I'd like to take a few minutes to talk to you about regenerative injection techniques, what we call RIT. These are 3 different injection techniques that we use to treat ligaments and joints in patients who have chronic pain from ligament or tendon injuries or joint injuries that could even just be plain old arthritis. Regenerative medicine is a type of medicine that seeks to promote natural healing within the body. In other words, techniques that try to get the body to heal something that it has not been able to heal on its own. In the case of a joint that's painful because of arthritis or possibly because of damage to a ligament or a tendon that might attach in and around that joint, there are 3 different types of injection techniques that we offer that are all part of regenerative medicine. Those include prolotherapy, PRP injections, and PRP stands for platelet-rich plasma, and then stem cell injections. And in that order, they kind of go from less intense to more intense therapy. PRP injections, again, involve injecting platelet-rich plasma. That is something that we prepare from the patient's own blood. So we draw blood from the patient's arm, spin it, and prepare this platelet-rich plasma, which, as the name implies, is a very concentrated amount of platelets suspended in plasma, and we've gotten rid of the red blood cells and the white blood cells. The reason that we inject PRP is that platelets are intimately involved in the healing process throughout the body, and so besides helping to form blood clots, which many people know they do, they also release growth factors, which are biologic signaling molecules that help to direct healing processes. So when a body part is injured and we inject PRP in that area, it greatly promotes some of the natural healing that the body can achieve in that area. When we inject PRP, we're not technically using inflammation, and again, we're utilizing the platelets to release growth factors, and so there's a different mechanism to healing, and it's not nearly as painful as prolotherapy. In fact, very often there's hardly any pain associated with it at all. It still leads to very good healing, and usually better healing, or I should say quicker healing, than with prolotherapy. The treatment still can be repeated approximately every month, depending on how the patient is doing. Although again, usually we see fewer treatments needed when we do PRP than when we do prolotherapy. The success rate increases as you go from prolotherapy to PRP to stem cell. The success rate with stem cell approaches probably 80+%, which is really fantastic. Most surgeons can't even offer that kind of benefit. PRP is probably more on the order of about 60 to 80%. Unfortunately, at this point, none of these injection techniques are covered by insurance. So they do get a little bit more expensive as you move up from prolotherapy to PRP and ultimately to stem cell injections. We do have a variety of different ways to assist patients with payment options. And so if these are treatments that you're interested in, I would encourage you not to let finances be an obstacle to having the treatment that could help you. By all means, come on in and we can have someone talk with you about the different ways that you might be able to afford this. It's a very safe technique. All 3 of these different injections are extremely safe. Areas where we would not want to do injections would be areas where there's an infectious process going on, area where there might be cancer, injecting in a joint that has artificial parts in it, certainly a joint that's already been replaced. We're unlikely to get any benefit from these injections, and they would also increase risk for infection in that sort of a setting. Patients who have to take anti-inflammatory medicines or steroids on an ongoing basis, that affects the likelihood that prolotherapy would work because, again, those medicines will counter the inflammation of prolotherapy. So anyone that requires ongoing anti-inflammatory or steroid medication for whatever health issues they might have, they would not be good candidates for prolotherapy, but they might still be very good candidates for PRP or stem cell. Otherwise, it can be done in a wide range of different conditions. They're very long-lasting because these injection techniques are literally promoting natural healing within the body. When they work, essentially the body has healed itself. So unless you re-injure those structures, we don't expect that you're going to need ongoing treatment. There shouldn't be any requirement for chronic, repetitive prolotherapy or PRP, and certainly not stem cell injections. In fact, stem cell injections really should only require one treatment, period. The answer to that in part depends on how far from your normal routine you are before we do the injections. Some people haven't worked for quite some time before we treat them, and so we don't expect them to get back to work right away. But yeah, if you've been working and functioning in a fairly normal capacity, we don't really expect any downtime whatsoever from these injections. Again, with the stem cell injections, primarily because of the fat harvesting, we usually do recommend that you consider being off work for 2 to 3 days. For that purpose, we usually tend to schedule those on a Thursday, which ends up being good timing because people can hopefully take Friday off and be off for the weekend, and by Monday we expect they'll be back to work. Thank you very much for taking the time to listen to our discussion on regenerative injection techniques. I hope that this was informative. If you happen to be someone or know someone who might benefit from these injection techniques, I would encourage you to consider coming in to talk to me or one of the physician assistants in the practice. We'd be very happy to see you and discuss these with you in more detail.